The Center for American Progress, a liberal public policy group, criticized Republican Senator John McCain's health care policy at an event dubbed McCain University on June 30th. Democratic Senator Barack Obama's health care policy was not criticized during the talk, but one panelist told CNSnews.com that his plan is far more attractive than McCain's. Healthcare policy expert Michael Tanner of the Free Market Cato Institute did not speak at the event. CNSnews.com spoke with him about the multi-billion-dollar costs of both plans. Here's the report. Karen Politz, director of Georgetown University's Health Policy Institute, says McCain's plan offers nothing but bad choices and will leave millions of people uninsured.
This plan offers them a lot of bad choices, and when they become very sick, very few choices at all. So I think it offers them the choice of medical debt, of medical bankruptcy, of not being able to access care that they need because they can't afford it, the choice of losing your home, the choice of watching a family member suffer or maybe even die because they can't access care. Those aren't good choices.
McCain's plan puts more of a focus on individuals rather than groups, which some say will make America's current healthcare system worse. Peter Harbridge, a healthcare advisor to former presidential candidate John Edwards, was a stand-in on the panel for Elizabeth Edwards. He says McCain's plan does not effectively cover people with pre-existing conditions.
The $10 billion that you're talking about, that you're asking about, has to do with people with pre-existing conditions and how do you help them get health insurance. Senator McCain has said that his preference would be for everyone to be in the individual market, and it's well established that people in the individual market have difficulty obtaining insurance, getting the insurance that they need because they cost more, they have these pre-existing conditions.
There were no direct references to Senator Obama's plan during the discussion, so I spoke to some of the panelists about the alternatives he has proposed.
Well, Senator Obama is offering a completely different approach to health care. So he looks at how can we improve the number of people who have group coverage, solid coverage in the United States, and how can we make coverage more affordable for the people who have it today as well as for people who don't have it now. And what I think is just far more attractive about that is instead of sending people off on their own with a little tax credit to go find an insurance company who is willing to take them, he's talking about putting people into large groups. So whether it's through expanding eligibility for the Medicaid program or what would benefit a lot of people is his idea of a national insurance exchange. He's looking at how do we get group coverage, which is going to be more stable and more affordable and have better benefits than anything that Senator McCain is offering.
Healthcare policy expert Michael Tanner says Obama's plan covers more people but outweighs the cost of McCain's by a large margin.
Neither Senator McCain nor Senator Obama are going to cover everybody. Neither plan is a universal coverage plan. Senator Obama may or may not come closer. Various estimates suggest that he would leave between 2 and 15 million Americans uninsured under his plan. Senator McCain would cover about 27 million more Americans under his plan, leaving somewhere around 20 million uninsured. So neither one gets to 100%. In terms of cost, Senator Obama's plan would cost about $65 billion a year in new taxes. Senator McCain's, the National Taxpayers Union estimates, is somewhere between a wash and about $10 billion a year. So it's a much cheaper plan, not as ambitious, but it would give Americans, I think, more choice.
Nicholas Ballasy, CNSnews.com, Washington.
The kind of deregulation that we've been